Infections can occur at any time throughout pregnancy and in the weeks after birth. We need to be alert and recognize patients that may show early signs of an infection. Prompt diagnosis and treatment can help stop life-threatening complications from infection, including sepsis. If your patient is feeling generally unwell or has a fever, pain, or producing pus from a wound, it could indicate a bacterial infection. A high heart rate, breathing fast, or a drop in blood pressure are warning signs to look out for. They can indicate severe infection, as can drowsiness and confusion. If blood investigations are available, a white cell blood count higher or lower than the normal range can also indicate an infection. Pregnant and postnatal women are prone to infections in many different body systems, particularly after cesarean section. If there are signs of infection, it is important to consider where in the body the infection is coming from, the source of the infection. The most common sources are from surgical wounds, the urinary tract, and the respiratory tract. Because prompt treatment of infection is so important, we often have to start antibiotics before we know exactly which type of infection we are treating. It is important to start antibiotic treatment promptly if infection is suspected. Local guidelines should help you choose the correct treatment. Think about the following questions whilst using local guidelines to decide which treatment to use. What is the likely source of infection? Did the infection start in the community or in hospital? Some types of bacteria are more common in hospital and need specific antibiotics. This is why hand hygiene in the clinical setting is so important. Some healthcare facilities can test and identify bacteria to target treatment. Waiting for test results takes time, which is why early treatment is important. If possible, take samples to help identify the bacteria, but do not delay starting treatment. Samples for testing should be taken from the suspected source of the infection, such as urine, sputum, or pus from a wound. Continued assessment is vital. Always consider if antibiotics should be continued, adjusted, or stopped, depending on the progress of the patient. Try to use the right antibiotics for the right amount of time, and always seek help and advice if you are unsure. Recognizing infection and starting treatment straight away using best practice and local guidelines gives your patients the best chance of recovering quickly.